So this is Future Debbie, Editing Debbie, however you want to refer to her. And this is just my basic disclaimer. I'm going to put this at the beginning of all my videos. I am not a medical doctor. I am not a medical professional. I'm not a medical student. I don't play one on TV. I have no medical knowledge. So anything that you see in this video should not be confused as medical advice. It is just me telling the story of what happened to me. Anything expressed in here is my opinion. And it's not meant to be advice. Like I said, it's not meant to be medical advice. If you have a health condition, if you have any kind of problem that is making you look for this video, consult your doctor. And if you choose to take anything I say as medical advice, I am not responsible for that. I'm just sharing my journey with you. So just keep that in mind, okay? Hi, I'm back. It is Friday, and I got the results from my biopsy on Wednesday, so it's taken me a couple of days to kind of clear the brain fog. To the hospital on Wednesday. So the funny thing is that when I got up there weren't very many people in line ahead of me. The previous day when I had been there, the previous time, which was on Monday, it was swamped. It was Monday morning, first thing, 9 o'clock, everybody's in and out, and it was like lots of people there. There's a girl, the way the hospital is set up, you walk down the hall, they call it the gallery. There's a big, long, wide hallway, and there's chairs in there and everything. There's suites that off to the side, and then the offices go out from that hallway where you can't see them. They go back behind doors. So suite 230, that's the first suite you come to, that is, it's the cashier. You can make payments, you can do administrative stuff. So I had already been there a couple of times dealing with some administrative issues, and the young lady that was there had checked me in the other morning for my biopsy, so she knew me. So Wednesday when I went up there, I went to the next suite over is 240, and then 250. So 240 is where you do radiology, 250 is where you do blood work, and then the next one down was 260, which is the breast center. So you check in at 240, unless the line is big, in which the girl at 230 will come get you and check in. Anyway, got up there, and the girl from 230 was behind the desk talking to the other girls that were behind the desk, and she's like, "I know you." And I'm like, "Yeah." She's like, "You're here all the time?" I'm like, "Yeah, I'm gonna bring a bed and just start sleeping here, I think." So I was just, when I get stressed out, I make jokes. That's just one of the things that I do. So they have to ask you all the COVID questions. Have you been out of the country and all that stuff? And I'm like, yes, actually, I held my purse up. I'm like, I went to Paris last night and bought this purse, and they were laughing. And she's like, well, yes, it's very pretty. I'm like, Walmart special, Anyway, so they got me checked in. We were joking and everything, and I went and sat down. And I literally sat down, and the lady came out the door for me. Her name is Christine. And she called me back, and I'm like, wow, that was fast. So we went back, and we went into a little side room, has a little couch and chair and everything. And she had some papers with her, and she said, well, first thing, let's just get this out of the way. Number one, it is not breast cancer. Big sigh of relief. Yay, praise God. I was happy to hear. I was pretty sure it wasn't breast cancer, but I'm sorry, We're so conditioned, and I think it's a good thing, we're so conditioned to think that anything going wrong with our breasts is breast cancer. So, biopsy automatically associated with breast cancer. And given that I have had endometrial cancer and have gone through that whole thing before, I think it's pretty normal that my brain went to cancer. Anyway, so she said, but let's talk about your results. We sat down, and she had a paper, and she read off what it said to me. She gave me that paper, but also, thankfully, I can look at my results on my phone, although I can't read them without my glasses off. So it said, sections show multiple small fragments of a papillary neoplasm with usual ductal hyperplasia, apocrine metaplasia, and columnar cell changes. Negative for cytologic atypia favor interductal papilloma. And it says the final diagnosis is papillary neoplasm without atypia, fibrocystic changes with dense stromal fibrosis. So basically what that means is that it's not cancer, and all those other words, some of those words just mean the different tests that they were looking for. I went to cancer.org and looked up all of the information about all of those things. And so basically when they take the biopsy, they look at it with the naked eye. That's called a gross examination. And then they look at it under the microscope, and then they look for specific things. They look at the cells and how they're lined up and how they're formed, and how they look. And so that's what all those different things meant. So basically the intraductal papilloma is that the cells are starting to make changes. And while it is not cancer right now, and there is no guarantee that it ever will become cancer, the chances are higher. From what I read on cancer.com, a person that has what I have has a 4 to 5 times higher chance of having cancer, of breast cancer, than the average woman does. So the way they treat this is they surgically remove it, which I was pretty sure that was going to be the end result anyway. So I have an appointment in 3 weeks to speak with a breast surgeon. Christine says that both of them are excellent doctors, that she would use either one, that she recommends both. I was familiar, one is Dr. Liu and one is Dr. Watts, and I am more familiar with Dr. Watts because I looked up information online about the breast center, and he is the director of the whole entire breast center at my hospital. So I feel very confident in him being the one to do the surgery. I've seen him on a local TV station when they were talking about how we got the brand new 3D mammography technology, so I feel like he's very personable. And I felt comfortable with him. I'm good either way at this point. I have a philosophy when it comes to doctors like this. Bedside manner is good, okay? But number one important thing to me is that they are a competent doctor. They're a competent surgeon. I can deal with lack of bedside manner if I have to. I prefer if I can get it. It's not... If I have to choose between competent doctor and bedside manner, I'm going to choose competent doctor. But I do believe it's very possible to have both. And that's what I was told, is that this doctor is both. That he's very transparent. He's very straightforward. He's always on time. He's like a tell it like it is kind of a doctor. But he will listen to my questions and he will talk with me about everything. So as I was sitting there talking to Christina, she said basically I can't remember the exact order in which these things were told to me, but she said that I'm going to need a front closure, a front zip sports bra, that I will be wearing that sports bra for 2 weeks after the surgery. I will not be able to have a shower for 48 hours after the surgery. And that I actually will wake up from the surgery with a bra on, that they give you a surgical bra from the hospital. She said, but it's not very attractive. It's kind of scratchy, and I'm a pretty big girl. There's nothing here for size comparison for you, but I wear a 3X clothing, and so I feel like the chances of them having that size of bra might be slim to none. So I was like, okay. I told her, I'm like, well, I have MCS. I'm very sensitive to even clothing and things like that, from the dyes and the sizing. And something that I did not know is that apparently some sports bras are made with antibacterial fabric, and I'm very sensitive to antibacterial stuff. If I have no choice, if that's all there is for me, then I will just be sick longer. My philosophy for myself is you have to set priorities. At this point, taking care of the breast issue, that's top priority. MCS now has been moved down a little bit, so that means if taking care of this means I have to be sick a little bit longer or be stupid for a little bit longer, okay, I'll deal with that. It'll take me longer to detox, it'll take me longer to come back, but I'll do what I have to do. This takes priority. Now, if we can make it to where they're both of the same level of priority, or this one is not as far down, that's ideal. So I mentioned that to her, and she said, well, there's no reason why you couldn't get your own sports bra ahead of time and get it cleaned up and ready to use. And she said, talk to the surgeon. Maybe he'll let you bring it with you the day of the surgery, and they might let you have that one put on you. So that started my quest for a sports bra, and I'll come back to that here in a minute. So anyway, we talked a little bit more. She was really nice. She called and set up the appointment. She wanted me to see the surgeon next week, and they were going to get me in on. She was really upset that it was going to take 3 weeks to get me in. They were going to get me in on a Monday, 3 weeks from now, but I'm like, can't. I have to go get an eye injection on that day, and I cannot move that. I felt like a consult appointment was less important than getting that eye injection, which, again, that's another video coming at a different point. But basically, I have to get an injection in my left eye because I have macular edema, and it has to be every 4 weeks. I was off by 5 days, and it really made a difference, and I was losing vision. So I'm legally blind in my left eye. It's getting better, thank God, because of the medication that we have injected in there once a month. Anyway, can't move that appointment. So the 18th was the next day. The next available day was that Wednesday, Thursday. I don't remember. Anyway, so that the appointment that I ended up having. So that's when I'm going to go. It's in the same building, so it's going to be easy to take care of. So I left. So I was in there. I got in there a little bit early. I got in there. Total time I was in there was like about 20 minutes. So I left about 10 minutes after my appointment was supposed to have started. Of course, because I got there early. So anyway, it was a very short appointment. I found it interesting when I walked out. I wasn't crying or anything. I went in there expecting to be told I was going to have surgery, but it's still rather sobering. That was the beginning of the feeling of being overwhelmed. Although I have been much more overwhelmed by other things in the past, so it's not as bad as it could have been. But I noticed as I was walking out, the ladies that were joking with me earlier, they kind of weren't looking at me. They knew where I was going, and they knew I was going in for a consult. Now, I don't think for a minute that they saw my results or anything, but I suspect that they know that chances are good that my consult wasn't going to go as well as it could have, or that I was going to come out feeling more sober. But I don't know if that was the issue or what the deal was, but it was funny to see. Not funny, haha, but interesting. I'm an observer of human nature, so it was interesting to me to see that they were kind of like, we're busy, when I walked past, which is okay. So I went outside and waited for my friend to come pick me up. It was raining and a little cool and kind of overcast. It's Missouri in October. Welcome to Missouri in October. And I just I took my mask off. In case somebody's seeing this in the future, it's still during COVID times and you have to be masked to go into that hospital. So I took my mask off and walked in the rain for a little bit, just for a couple of steps, just enough to get a little bit wet and a little chilly, but I was feeling, I don't know, a little melancholy already, just kind of like, okay, so thank you, God, it's not cancer, thank you, dodged a bullet. We went home, my friend took me home, and she and I, chit-chatted all the way home. I texted my daughters to let them know what was going on once I got home and, decompressed from everything. But so, yeah, I have a plan in place. That's where I'm at now. Now we wait. So I probably will not have another update on this part of the video or this part of the journey until after I go and see the surgeon. So it looks like there's going to be 2 more videos. There's going to be the video that starts with this, and then the results of talking to the surgeon, and then I'll probably make a 4th video of the surgery itself and the recovery afterwards. So anyway, so that's where we're at today, and that's what we're working on. I'm working on. So yeah, thank you for watching, and I hope that if you're going through a similar journey, this helps you in some way. Thank you, and God bless. Hi, so I'm back. Today is Thanksgiving Day 2021, and I thought that this would be a great time for me to video me talking about my experience visiting with the surgeon. I saw him 3 days ago. It was a great experience. So I'll just tell you about that quickly and then what the decision was. So anyway, went to the doctor's office, the basic stuff. You go in, they take your blood pressure. So basically, I talked with the nurse. She got all the information. She asked me a lot more questions than I've been asked before. things like family history, which is difficult for me to talk about because I'm adopted. I don't know much of the family history. I know she wanted to know specifically, do I have a mother, a sister, or a daughter that's had breast cancer? And I said no. That not that I know of. And did I have a mother, a daughter, or a sister that has had any kind of cancer? And I was able to say, well, I have a half sister that died from lung cancer, although she was a heavy smoker. And then from there we moved out to any other relatives. And I said, well, I have my mother's sister died from breast cancer. So I guess they look at degrees of how close, degrees of relativity. I don't know what the term is. Anyway, so they look at just first degree is really what makes a difference. So now, sadly, all my sisters and my half sisters and my daughter now will be able to say, well, I have a mom that had this issue. They asked about any kind of cancers, and I was able to say, because I've had endometrial cancer in the past, and so I was able to talk about that. We went over my supplements, and so that was, they updated my file, putting those things into the computer. And so basically it was just a little bit more information. And she said that basically what they do is that information is used to create a scale that tells them my risk factors, and that is what determines how things progress, I think. But she said the doctor would explain it to me, but actually he didn't, but that's okay. I kind of got the idea. Anyway, so she left. Well, no, she got done and she took out a folded square. It was about this big, about the size of like a spiral notebook, opened up. And it was blue, and she put it on the counter, and she said, the doctor will explain to you what to do with that here in a minute, and he'll be right in. I had been told that this doctor was very punctual and very matter of fact, but that he will sit and he will talk with you. So I was very happy about that. So I sat there a little bit longer, and he came in, and we talked for just a couple of minutes, and he looked over the history, and so he got up and he's like, okay, so this, he handed it to me. He's like, this is a drape for you to put on. He said, he opened it up to show me. He's like, you put it with the white part in the front and the blue part in the back. And so I'm going to insert a picture of it here. I didn't think to take a picture until after I had taken it off. But anyway, so it basically, again, I had this problem when I was doing the drape that they used for the mammogram. It almost didn't fit. I've been losing, actually, I've lost quite a bit of weight. And I went from a size 6X, and now I'm in a size 3X, and I just got into 3X, and it did fit. It actually fit and buttoned in the back. So, but it wasn't very, it's not meant to be like fashionable or cover a lot of skin, but basically it did cover me. And so, I did, when he was all done, I did say, may I respectfully suggest that you see if you can get these in a larger size? Because, anyway, so he came in, and so what he did is he lifted the drape up. I thought to myself, why didn't you just have me take my bra off and leave my shirt on? You could have lifted my shirt up, but whatever. Actually, he asked me if I could lay back, and I told him, I'm like, well, I'll do it, but I'll need a little bit of help. I have some PTSD about laying flat and laying back. And he's like, oh no, we can do it sitting up. And also I have an injured tailbone. I'm like, I can do it. Just let me go to my side and lay back. And he's like, no, let's just try it sitting up. If you can't do it with you sitting up, then we can work on that. And I'm like, okay, that would be great. So he lifted the drape up, and he started to look at my left breast, which is the one that has the discharge. But I also have a sebaceous cyst between my breasts. And he's like looking at the left breast, and then he's like, wait, what is, and he's like looking at the middle of my chest, and he's like, what is this? And he reached out and he was like touching it. And I'm like, I said, this is a sebaceous cyst. His name is Fred, and we don't like him very much. And he's like, oh, I can take care of that for you. And I'm like, would you please? I had made a list of all the things that I wanted to ask him, and I was going to ask him, while you're in there working on Lefty, could you please take care of Fred? And he volunteered. I was feeling a little bit weird. I'm like, I felt like that's not professional or polite or ethical to ask a doctor, hey, while you're doing this, can you do that? But he volunteered, and that made me so happy. And he's like looking, and he's like, yeah, we can take care of it. And a nurse had come in with him for the exam, which I totally appreciate. And I looked at her, and she's like, she was looking at it. I'm like, it used to be the size of a tennis ball. And she's like, she was like, yeah. I'm like, yeah, it drains. It's nasty. It's gross. I'm so happy that you're going to take care of it. So he went back to look at Lefty, and he's like, okay, I'm gonna pinch a little bit. It might hurt, and just basically telling me what he was doing. He was looking at things, and so it was over quickly. He was done in probably about 5 minutes. The exam, the whole thing from the time he walked in and the time he walked out was maybe 10 minutes. It would have been less if he hadn't been sidetracked by the sebaceous cyst, and that's fine. So he said, okay, go ahead and get dressed and I'll come back. So I got dressed, and within just a couple minutes he was back in, and so we sat down to talk. So where we are at now is that we have scheduled the surgery date. He's like, okay, so what we're going to do is the surgery. We talked about what the surgery was. I asked him, I'm like, okay, so how important is it that I have this surgery? Because, I'm not saying, okay, I don't want to have the surgery. I don't think anybody ever wants to have surgery unless you have a psychological problem, which is fine. I know there's lots of people out there that have that, but I don't have that. I have just the opposite. I don't want to have the surgery. But I also don't want to have problems later on down the line, and I just felt like it was only fair to ask him. I don't want to be the kind of person that just blindly follows what a doctor says without asking questions. And I felt like he was totally okay with me asking questions. He seemed to welcome them, and I'm grateful for that. So he basically explained that, he said, sometimes with the papillomas that are like just a couple of centimeters, or a couple of millimeters, we'll just watch them. He said, but yours is a centimeter. And he's like, it's getting a little bit big to not remove. And he said, we leave it in there, and you'll continue to have the symptoms. And it could start hurting. And I'm like, oh, okay. I didn't know it might start hurting. And I said, so is there, and there's an association between this and cancer. And he's like, well, we're not seeing a lot of cellular change right now. Now, if we were seeing a specific kind of cellular change, and he said a word that I don't remember what the word was, but the way he used it made me feel like that kind of cellular change indicates that it's cancerous. And so I'm like, okay, that's good enough for me. It's really basically, it's do it now while it's small and the surgery is uncomplicated, or wait until it's bigger and then they have to take more, or wait longer and then run the risk of it turning into cancer. I don't want to do that. So as much as I don't want to have a surgery, I feel like this is the smartest thing to do. It's the smartest time to do it. I asked him how long the surgery itself would take, and he said about a half an hour. So that right there makes me feel really great that it's not going to be big. The papilloma is a centimeter at its widest point. It's a little under a centimeter at the other axes. I think that's the right way to say it. So it's roughly a centimeter around. And then he'll take tissue from around it, a certain area, just to make sure that there's no other cellular change that maybe wasn't caught on the biopsy. The other thing that I spoke with the doctor about was the need for narcotic painkillers. I have a history of alcohol and drug abuse. I've been sober 29 years by the grace of God, and the idea of having narcotic painkillers, it just doesn't set well with me. When I had the hysterectomy 12 years ago, I went home after 4 days of being in the hospital, and I took one OxyContin on the way home. That's what they sent me home with. And it made everything look all blurry, and I hated it, and I didn't take any more after that. And I did the rest of my recovery just with Tylenol alone. Now, granted, those first 4 days, I had an epidural of morphine, so I wasn't feeling any pain. Those epidurals are amazing. Anyway, so the doctor said to me, he's like, and I had explained to him, I'm like, I'm not a fan of narcotics. And I told him, I'm like, I am concerned about addiction. And he said, well, I only give you, like a dozen. And he's like, and I don't refill. And he said, before I'll refill, you have to come in and talk to me about it. And I said, well, my concern is that I just don't, I've been sober for 29 years and I just don't want to go down that road again. And I think at that moment, I don't think I made myself clear the first time. I think he thought that I was concerned that I would become addicted, because he said that's not enough to get addicted. And then when I restated it, indicating that I had already had an addiction issue, I think his mind shifted and he realized where I was at. Where I'm at, I've like I said, I've been sober 29 years, but I still battle food addiction, because you have to eat. You don't have to drink and you don't have to smoke dope, but you have to eat. And where I'm at is when I'm mentally sober from food, I'm fine. But like one bag of potato chips, seriously, if I buy them, I buy a 1 ounce bag because that's one serving, and every once in a while I can get away with it. But by the time I'm done with that bag of chips, then the food addict in my brain clicks right in immediately, and she wakes up, and she's not a pleasant person. So then I obsess about food for days afterwards. So it's not always worth it for me. In fact, most of the time it's not worth it. Says the woman who currently has a small bag of potato chips in the fridge for my Thanksgiving dinner. Anyway, so I know myself well enough to know that I'm genuinely concerned that if I took some narcotic pain meds that I would have to battle that addiction again. And as it is, I'm going to be dealing with all of the emotions and all of the recovery and the brain energy it's going to take, and I'm going to have to be dealing with coming off of anesthetic, and I just didn't want something else in there. So anyway, I think, like I said, I think he understood where I was coming from at that point. He's like, well, he said, we could do a nerve block and then you wouldn't need any pain meds. And I'm like, I think that sounds great. So I didn't know what a nerve block was. And then later on, after I got home, I thought, maybe I should look at what a nerve block is. Basically, from what I can gather, if the research I did is correct, it's called, they've got 2 different nerve blocks for the chest area. It's called a PEC 1 and a PEC 2, colloquially. Basically, they go in up under the pec, like right here, underneath your armpit. And they use a big needle and they go in to a specific part of under the pectoralis, and I'm not saying that right, underneath the pec muscle, and they insert a certain number of cc's of a topical anesthetic, and that actually separates the muscles, and then it absorbs, and it blocks basically from here down to just under the rib cage, and from like here over. So it's perfect for a breast surgery because it numbs the muscle and the skin, and the breast itself. It numbs everything. So I'm a little freaked out at the idea of them injecting anesthetic into my muscles, but at the same time, I'm less freaked out by that than I am at the idea of having to take a narcotic. He said he was going to send me home with hydrocodone, and no, I just don't want it. And so I would have said, if he wasn't going to work with me, I would have said, okay, send it home with me. And then I probably would have filled it to have it, and I just probably would have taken it, but I would have been miserable. So I'm glad I spoke up, and I'm glad I communicated with him. So that's part of the reason I'm making these videos is, wow, I have been very blessed that every time I have communicated a concern, they've listened to me. Now, they've not always accommodated me. We've talked about it, and I have understood why certain things were done a specific way, but a couple of times they've accommodated me and we made a workaround. So this is another one of those examples. And I'm very happy with that decision. So I just need to remember to tell the anesthesiologist that Dr. W said that I can have a nerve block. So there's that. And those were really basically my questions. I had a whole list of questions, and then I had them on my cell phone, and then like an idiot, I erased them because I thought I was going to transfer them to a different app, and then I couldn't transfer it. And so then I had to go by memory on what those questions were, and I don't remember most of them now. So I missed several questions. Honestly, I even missed a couple of the questions that after I realized I had erased all the questions, I wrote a list on a piece of paper, and I took that list in with me, and even sitting there talking to him, I forgot to ask some of them because it was just really overwhelming. it's just a lot of information, and my brain doesn't work that way. My brain kind of gets foggy. Usually I take somebody with me to ask questions, but in COVID, they don't allow people in the rooms with you most of the time. So I'm going to email my doctor and ask him the questions that I forgot. The doctor said that I will need somebody with me at least overnight. My surgery is scheduled for 8 o'clock in the morning. I have to be there at 6, so we'll be driving over there in the dark. I expected that, and I'm actually okay with that. It sounds like I may be the first or possibly the second surgery of the day. It depends on when he actually starts his surgeries. But that's fine. If it's only a half an hour surgery, it sounds like I might actually be home by the afternoon, which I'm great with. So if he said if I had somebody stay with me, just overnight, that would be probably close to 24 hours. So my daughter has offered to come and stay with me. And then I told him, I said, I'm concerned about climbing the stairs up to my apartment. I said that I live on a second floor apartment and they're concrete and metal stairs, and I'm a big person. And I said, I have a son, he's 6'3" and 300 pounds. I said, he has offered to come and help me go up the stairs. And he's like, I think that's a really good idea. Have him go with you to make sure you get up the stairs, and then have him stay the night. And I just smiled at him. I'm like, I love my son, but I'm going to need help bathing after this, because even if I can't have a shower, we're going to figure out how to wash my skin and my hair while leaving, the compression garment on. But anyway, so we've got it kind of figured out. My friend is going to take me that morning, and she'll be with me there the day of. My daughter will come over. On the way home, we're going to pick up my son, and we got all the logistics figured out. So that's the end of this video about my appointment. I'm going to make probably one more about the placement of the Navi Scout, and then probably a separate one about the surgery itself. So hopefully I'll get these all worked up and you can see them soon. So thanks for watching. As always, if you have any questions, put them down in the comments. I'll do my best to answer them. And